Come in.
Hello,
Hello.
my name is Tyler. I'm gonna be your student nurse today.
Hello, Tyler.
Can you just tell me your name and date of birth, please?
My name is Michael Kosla. My birthday is September 4th, 1991.
Alrighty, perfect. So today, if it's okay with you, I'm gonna be performing a head-to-toe assessment. It should take about 10 to 15 minutes. Just so you know, I am gonna be touching you and moving your gown around. Would that be okay with you?
Yeah, that's fine.
Alrighty, perfect. So just looking at you from your body position, you're in a good position, seated straight up. You look comfortable. Your hygiene, you look very well kept. Nutritional status seems very adequate. You seem very well nutritioned. And I saw you walk in here. You had a very steady gait. I didn't see no compensating or favoring one side. And I didn't see you with any assistive devices. Is that you don't use any at all at home or
No.
anything? Alrighty, perfect. Sounds good. So can I ask you today, are you in any pain?
Yes.
Where at?
My thigh here.
Okay. What brings on this pain?
Just kind of, like walking, like brisk walking does.
Walking? Okay.
Like brisk walking.
If you could describe this pain, how would you describe it? As like maybe a burning, a pulsating,
It's like
throbbing?
Yeah, it's like throbbing, aching.
Throbbing, and you said walking kind of brings it on?
Well, like faster walking. Like,
Faster walking? Okay. Are you doing anything to help this pain? Maybe icing?
just some Tylenol.
Okay, alrighty. And with this pain, is it just in your leg, or do you feel when this pain comes on, it radiates to another area of your body?
No, it just stays in one area.
Stays in one area? Okay. And how long has this been going on for?
About like a week now.
Okay, a week. And as far as medications, you said you just use Tylenol when
Yep.
it acts up? Okay, alrighty, sounds good. I'll make a note of that for the doctor, and we'll see what we can do for you, okay?
Okay.
Alrighty, perfect. Alrighty, so I already asked your name and date of birth. Just another question. Do you know where you are right now?
Yes, we are in the health and science building, the nursing building essentially.
Okay,
And I'm here for head to toe.
Alrighty. Can you just tell me today's date, please?
That would be the 1st of May.
Alrighty, perfect. I'd say A&O times 4, you know where you are at this moment. And so now I'm just gonna palpate your scalp, okay?
Mhm.
I'm gonna be looking for any masses, lesions. Alright, and I'm gonna go, here, you're good, you can tilt your head up. I'm gonna go right into your lymph nodes. Do you feel any pain?
No.
Alrighty, sounds good. Just from palpating you, I would say your hair looks very evenly distributed. I didn't feel any mass, no lesions, so everything looks good there. And with your lymph nodes, they were not palpable, so that's a good sign. No signs of infection or any illness of any kind. So next, oh, perfect. Alrighty, so I'm just gonna have you stare straight ahead, okay? I'm gonna look in your eyes. Alrighty, perfect. And then I'm gonna have you look at my pen, and you're gonna follow it without moving your head, okay?
Alright.
Perfect. Alright, sorry about that. I would say your pupils are equal, round, reactive to light, and they accommodate appropriately. And for your cardinal fields of gaze, I would say cranial nerves 3, 4, and 6 are intact, so everything looks good there with your eyes. So now I'm just gonna take a look inside your ears, okay?
Mm-hmm.
I'm gonna pull your pinna up and back. Alrighty, with that, see a little bit of wax, but it seems to be normal. The inside looks gray, mucous membranes look pink and healthy. Alright, I'm gonna look at your other side, pinna up and back. Same thing, a little bit of earwax present, but mucous membranes look pink and healthy. Alright, can you go ahead and just point your nose to the ceiling for me? I'm gonna take a look inside your nose. Alrighty, perfect. Mucous membranes look intact, and like I said, pink and healthy. Can you do me a favor and can you breathe out of this on your nose? Alrighty, breathe out of that side. Alright, no signs of deviated septum. And just from looking at you, the skin on your nose looks, fine. No signs of breakdown. Same with the back of your ear, no signs of breakdown. Looks very fleshy and healthy. And can you go ahead and give me ah? Alrighty, I'm checking inside your mouth. Mucous membranes look pink and healthy. I would grade your tonsils a +1. Under your tongue, same thing. Can you put your tongue down? Alrighty, no signs of thrush or the presence of anything on the tongue. Alright, everything looks healthy. Can you just go ahead and give me a smile? And can you go ahead and puff your cheeks? Alright, as far as symmetry goes, face is symmetrical. Yeah, cool. Alrighty. Oh, and one more thing. Can you give me a shoulder shrug, push against me? Alrighty, perfect. I'd rate that strength a 5. Alrighty, so now I'm just gonna assess your breathing, okay?
Right.
And each time I move my stethoscope, just go ahead and take another deep breath for me, okay?
All right.
Alrighty, perfect. I'm just gonna do your back now, same thing.
Mm-hmm.
Awesome. Alrighty, everything looks good. No adventitious sounds, all clear throughout. And I'm going ahead and check you for CVA tenderness, make sure your kidneys are okay. Just tell me if you feel any pain, okay?
All right. Nope.
No? Alrighty. On your other side?
Nope.
Nope. Alrighty. Perfect. Like I said, no adventitious sounds and clear throughout. And I would look at your chest. I don't see any scars, wounds, lesions. Same with your back. Everything looks good. Couple pimples, but other than that, nothing major. Alrighty. So I'm gonna go ahead. Can you just tilt your head up for me? Alright, so looking at your neck, I see no distension of jugular veins. Alrighty, as he's breathing, I don't see the heart, pumping out of his chest. The precardium looks intact. Alrighty, and I'm just gonna go ahead and take a listen to your heart now, okay?
Alright.
Alrighty, I'm just gonna check your radial pulse. Alrighty, perfect.
Yeah.
Alrighty, I listened to your aortic valve, pulmonary valve, Erb's point, tricuspid valve, and mitral valve. And then I listened to your mitral valve with your radial pulse. I would say they're in sync, which is good. And yeah, it sounded, I'd rate your pulse as a +2. Everything looks good and normal. I'm gonna test both your radial pulses at the same time. Perfect. Those are synchronous as well. Peripheral pulses, once again, are +2. Everything looks good. Can I just see your fingers for me? Alrighty. I'm gonna go ahead and do cap refill. Perfect, less than 3 seconds. Do a skin turgor test. Less than 3 seconds, so adequate perfusion to the periphery, and he looks well hydrated, no signs of tenting. And I'm seeing a little bit of clubbing. Do did you ever live in an area of low oxygen where you had a
Yep.
high altitude?
Yep.
Okay, and how long did you live up there?
Years.
Years? Okay,
Years.
okay. So that would explain the clubbing on your fingers. Alrighty, sounds good. Get everything there. Alrighty, one more thing. I'm just going to, I'm gonna assess your carotid artery. I'm just gonna take a listen for any signs of a bruit. Alrighty. Perfect. I'm not hearing any bruit sounds.
Mm-hmm.
Alrighty, I'm just gonna feel. Perfect. Alrighty, carotid artery pulse is 2, normal. Everything sounds good. No signs of a bruit. Alrighty. Alrighty. I'm just gonna have you. Can you do me a favor and lay on your back, please? I'm gonna take a look at your abdomen. Alrighty, and looking at you, I'm not seeing any distension, no signs of ascites. You look very relaxed. And alright, I'm just gonna go ahead and take a listen, okay?
Mm-hmm.
Perfect. Alrighty, I'm just gonna go ahead and feel around, okay? You let me know if anything hurts. Did you feel any pain?
Nope. No pain.
Alrighty. So I would say that bell sounds are present in all 4 quadrants, and upon palpation, patient reported no pain. So I mean his organs or internal organs are fine. There's no signs of inflammation. Alrighty, perfect. And then can I ask you what was the date of your last bowel movement?
Yesterday.
Yesterday. All right. And did you notice anything different? Any pain? Any different odor? Any different color?
No.
Okay. And how about as far as peeing? Are you peeing frequently throughout the day?
No.
Staying hydrated?
Just normal.
Normally? Okay. Nothing abnormal. Alrighty. Perfect. Sounds good. Alrighty. I'm just gonna have you sit up for me, and I'm gonna take a look at your lower legs. Looking at you, I don't see any lesions, wounds. Skin is intact. Skin is dry. I'm looking at your feet. I'm just gonna take I'm gonna take a pedal pulse. Alrighty, I would rate your pedal pulse as a +2. And I'm gonna take your posterior tib. Alrighty, I would give those a +2 as well. And they are both in sync, which is great. Alright, I'm just gonna do a cap refill on your toe. Perfect. I would say less than 3 seconds. So adequate perfusion to the periphery. Go ahead and can you go ahead and point your toes to the ceiling? Alrighty. Yep, point your toes to the ceiling. Alrighty, point your toes to the floor. Alright, perfect. I would rate plantar flexion and dorsiflexion. I would rate those a 5 on as far as strength. Okay. Alrighty, I'm just gonna go ahead and test your reflexes, okay?
Mm-hmm.
Here, just elevate your feet for me. I'm gonna try that again. Perfect. Perfect. Alright, I would rate your reflexes a 2. Everything looks normal. Yeah, like I said, there's legs look good. Skin was warm upon touch. Skin was dry. Everything looks good. And I believe that's it. Do you have any questions for me?
No.
Good?
Good.
Alrighty, sounds good. Well,
Sounds
thank
good.
you very much for your time.
Thank you so much.
Awesome.